Hi, I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And today, guys, we're coming to you from home because of the pandemic. Desperate times calls for desperate measures. But
Yes.
yeah, so this is part two today of our diabetes series. So today we're going to talk to you primarily about how, like, if you get diagnosed with diabetes, how you would go about managing it. So, B, you want to go ahead and get started?
Yeah. So a lot of times a lot of my patients ask me, well, how do I know that that they have diabetes? How can I tell if they were diagnosed with diabetes? So there's different tests that we can do. One of them is the A1C, hemoglobin A1C.
Mhm.
Another test is the fasting blood glucose, and also the oral glucose tolerance test. So usually with the A1C, that's usually like the gold standard test. Usually any A1C greater than 6.5 can give you a diagnosis of type 2 diabetes. And if you have A1C between 5.7 and 6.4, it puts you in that pre-diabetes stage, so we can try to get you where you don't cross over to diabetes.
Yeah. So that's what people usually call borderline diabetes.
Yeah. Yeah.
Most of the patients come in and be like, I don't have diabetes, but they
I'm
said
borderline. Yeah,
yeah,
you're right. You're right.
that's
Right.
pre-diabetes.
So then some people can use some physicians or practitioners use the fasting blood glucose test,
Mm-hmm.
which you fast for 8 to 10 hours. They check your blood work. If the fasting blood glucose is greater than 200, but it has to be on 2 occasions,
Right.
then they can go ahead and diagnose you with diabetes. And usually you don't see the oral glucose tolerance test. Usually with pregnant patients. Pregnant patients usually get that test to diagnose them with diabetes.
Yeah. And then some of the other labs that, if you get diagnosed with diabetes, some of the other labs that we look at is like your CMP because we want to make sure your kidneys are functioning well. We look at your liver function because that's how most medication is metabolized. We monitor your cholesterol
Yes.
and urine microalbumin. So you,
Checking for protein in that urine.
yeah. So
Yeah,
basically,
because
oh,
go ahead. No, I was saying we check for protein in the urine because protein is too big to leak through the urine. So whenever you see protein in the urine, that tells us that your kidneys may be damaged. But
right.
it's too big to leak through the kidneys, not the urine, but too big to leak through the kidneys. So that
Yeah.
can tell us that your kidneys are damaged.
Yeah. And sometimes we also will look at a urine analysis, and if you have glucose in your urine, then we know you're not very well controlled, and we look for ketones in your urine. So those are some of the things that some of the other tests that we use to determine how well controlled your diabetes is.
So, B, what is the goal? Like, what is the goal of the diabetes treatment? What are we trying to do?
So we're trying to preserve your organs. We're trying to get typically when somebody is diagnosed with diabetes, our goal A1C is to be less than 7, even though above 6.5 is when you're diagnosed. But if you're below, if you're 7 and below, then we consider that pretty well managed diabetes.
Okay. And so one of the things I tell my patient is the whole goal is to lower your blood glucose levels. Like that's what we're trying to do. You
Mm-hmm.
was diagnosed because your blood glucose levels were elevated. So our whole goal is to lower those blood glucose levels. And with lowering them, we're trying to prevent organ damage to your eyes, damage to your kidneys, damage to your nerves of your fingers and your feet. So that's like the whole goal, what we're trying to do when we say we want to control type 2 diabetes.
Right. So, and then the reason why is whenever, your A1C drops by 1%, then it is associated with better outcomes over time. And so
Yeah.
basically what the A1C is a percentage of what your blood sugar has ran for the past 3 months. So that's why you get your labs done every 3 months. So the A1C is done every 90 days. And insurance really honestly only pays for it every 90 days.
Yes, we know that.
Yeah.
Yes, we do know that. And they only pay for every 90 days.
Yeah.
Yes. But the good thing is now, I see that they have like the little rapid A1C test, the point of care testing,
Mm-hmm.
where I see some providers going into the homes and they're able to get the A1C back in like 5 minutes
Yeah.
with the rapid test. So that's a good thing. So hopefully one day the patients be able to check their only A1C one day.
Yeah.
Hopefully.
That's true.
Yeah.
And then, we also have that option at the clinic to do the point of care testing. And so I think it's very beneficial because when the patient's there, we're able to go ahead and say, this is what your A1C is, and, adjust medicines if we need to, congratulate them on improving their numbers if they're,
Yes, yes.
but yeah, so the A1C is the biggest thing that we look at.
Yeah. So then, so once we get the lab work back and we see that they're diabetes, so then we start thinking about different treatment options, be it medications, it can be oral medications, insulin, injectables.
Mm.
If everybody don't start off on medication, some people we choose to just go straight to lifestyle modifications, some type of lifestyle changes. Some of us we have access to a dietitian. So we do a lot of medical nutritional therapy where we're at because we have a dietitian who can meet with them, help them, give them a nutritional plan, help them lose weight.
Yeah, and with those, just those modifications alone, you can lower your A1C down to a healthy, like if you get your weight within a healthy range, you start eating healthy, making healthy choices, exercising, then you can get your A1C down. Of course, you may still need medicine, but there's always a possibility that you can come off medicine if you have to end up taking medicine.
Okay, so B, let's talk about dieting. I know that you're big on dieting and exercising. You have me dieting and exercising or trying to, lower my blood sugar and cholesterol. So let's talk about that.
Your blood sugar's fine.
Yeah, but I'm just saying that you're the guru for dieting and exercising.
I don't know that I'm the guru, but I exercise for, multiple reasons. One, to stay healthy physically, but also mentally. But yeah, so the goal, just kind of a broad goal, I guess maybe not broad, but like a standard goal is to have your BMI less than 25. Your BMI is your body mass index. And so that number comes from your height and your weight. And there's BMI calculators online that you can plug your numbers into and see where you're at. But anything above 25 is overweight. Anything above 30 is obese. And anything above 40 is morbidly obese. So that's just kind of a guide to help you kind of see where you need to be, how much weight you need to lose. So, and then also to help achieve those goals, you want to change the way you're eating, you want to exercise. How many days a week, D?
5 days.
Yeah.
I say 5 days, at least 60 minutes, 5 days. Most days a week. I tell them 5 days a week.
Yeah, because it's just take 2 days off, exercise. Fine. Yes. That's fine. You'll be fine. You'll appreciate it later.
So one of the things that I try to do with my patients when they come in and we talk about diabetes, I talk about a diet. Mm-hmm. So one of the diets that I try to show them is the plate method. So this is a little picture of the plate that I like to show them. Can you see that, B?
Yeah.
So this is a picture of the plate that I like to show my patients when they come in. Let's see. So half of the plate is what? Green leafy vegetables. Mm-hmm. 1/4 of the plate is a lean piece of meat. Okay.
Like turkey.
Like turkey, chicken. Fish. What about fish?
Fish is okay. Nothing fried, mostly baked or grilled.
Okay. And then we have 1/4 of the plate may be a starch.
Yeah.
Which we want that to be a healthy starch be. And what are some of the healthy starches?
Like brown rice, quinoa, sweet potatoes, not the regular potatoes, which I think we talked about in our previous diabetes video. But yeah, so just like grains, oats, something like that. Nothing like the white bread or white rice, because that all breaks down into sugar.
And sometimes we do offer a piece of fruit. Mm-hmm. As you can see, this is peaches. It's only three pieces of peaches. Mm-hmm. And
fruit has a lot of sugar in it, so you have to be careful on how much fruit you consume if you're diabetic.
Yeah. Cup of milk, cup of water.
I'd recommend water over milk.
Yes. Okay. And sometimes you can have like a little free area. But if you see, it's very small. Compare this to the rest of your plate.
Yeah.
It's a very small portion of
That's
whatever
like
you're freeloading.
probably less than probably like half of the size of it. Yeah.
So I recommend that my patients follow this plate method.
Me too.
So one of the things that I've learned how to do is I grew up eating with a big round plate. So I use a saucer as I try to put my food on there, a smaller plate, and use that so I can like just change the amount of food that I'm eating.
Yeah. And she doesn't mean like a saucer for each portion.
No,
Just
no.
a sauce
No.
for her entire meal.
Yes. So that's one of the things I started doing with me and my husband. We just started changing our plate size. And to be honest with you, it helps. It helps.
Yeah. And
Okay.
then if you cut back like on sugary drinks like sodas, sweet tea, Kool-Aid, you'll eliminate a lot of sugar out of your diet, and it'll help lower your blood sugar.
Okay. So another method, Brandy, that some of patients may use is carbohydrate counting.
Mm-hmm.
And they try to decrease the amount of carbohydrate intake that they have. So I know that when we think about carbs, there are good carbs, there are bad carbs.
Mm-hmm.
The carbs that we want our patients to eat is like green leafy vegetables, whole grains, beans.
Mm-hmm.
If they drink milk, non-fat, low-fat milk, we want them to avoid stuff like, let's see, what's a starchy vegetable? Corn.
Yeah.
Corn. Instead of eating corn, do your little spinach.
Mm-hmm.
And
it's like the worst. I mean, this is basically sugar. Just like, because they put that corn syrup in everything and it makes everything sweet and tastes good, but it is not good for you at all.
And I find as though my patients who are on insulin, if they can watch the amount of carbohydrate intake that they intake, it helps lower their blood sugar, and it really allows the insulin to work really well to help their blood sugar get lower. Mm-hmm. So I just try to tell them just to watch the watch the bad carbs and try to eat more good carbs. Now I know that you have some samples of different sugars.
Oh yeah.
Sugar samples.
So what do you want to see?
I want to see how much of sugar. Do you have a candy bar?
Let's see.
How much sugar is in a candy bar?
Candy bar. I have, oh my gosh, Hershey bar.
Okay, so tell me how much sugar is in Hershey bar.
1.55 ounces of sugar.
So that's the amount of sugar that's in the Hershey bar?
Yes.
Oh my God.
Yeah. So
instead of buying a Hershey bar, you can just eat some sugar.
Yeah.
That's what you're doing.
Yep.
Wow.
Don't even waste your money. Just go in the kitchen and pour up you 1.5 ounces of sugar and just eat it. But look how much sugar is in a soda.
Wait, that's a canned cold drink? Where?
12 ounces. This is not the 20 ounce.
That's a 12-ounce can soda, cold drink, soda, whatever you call it.
That's how much sugar is in there.
That's a lot of sugar.
This is not this is a skinny tube, but this one kind of fat.
I see that's thicker than the other two that you have. Yeah. Oh my God.
And then what else do you want? You want to just get 2 tablespoons of pancake syrup?
That's 2 tablespoons. That's not 2 tablespoons, not a cup, the small cups that they give you if you go to IHOP or somewhere. That's 2 tablespoons.
Yeah. So the cup you get at IHOP is probably
a Waffle House. They put it in a cup, you get it to go.
Yeah. Oh. Yeah. That's sad. What else do I have here? Ice cream, 1 cup of vanilla ice cream.
Okay.
So this is, if you look at it like this, it gives you a better perspective. Like this is you just
eating sugar.
The top off and just being like, yeah.
Who wants to eat sugar like that?
Got my sugar for the day. But you don't realize it because it's baked into something else. It's baked into a cookie, and which, the part that they use to bake the cookie, the flour and stuff, and that breaks down into sugar. But this is just 1 cookie. One 3-inch chocolate chip cookie.
Wow.
Just 1 little.
So I'm glad you're showing this to us like this because it gives you a different perspective.
Yeah.
you can see how much sugar you're intaking. So I'm going to change some stuff just by looking at this.
And then even Jello. This is Jello. This is a half a cup of Jello. They give Jello out at the hospitals like candy.
Yeah, yeah.
So then people go home and they're like, "Oh, they were giving me Jello at the hospital. It's fine. I can
The hospitals, nursing homes.
mix
That's just a dessert.
pressure pills up in some Jello.
Wow, wow.
Just get you nice and yeah. But so yeah, that's just kind of an example of like how much sugar can be in something that you feel like is so innocent. Like one cookie. Who isn't like, oh, I'll just have one cookie. It'll be fine.
You want 4 or 5 cookies with some milk.
Yeah, you get
But
4.
just imagine eating. Sure, do you have the cookie one again? Because I'm just looking at that. 4 or 5 cookies with some milk. That's a lot of sugar. So that's 4 or 5.
Here's a cookie.
So just think about that. So
One.
when you get cookies, you usually do 4 or 5 cookies. You get at least 4 cookies. Nobody really eats one cookie.
Not at all.
That's a lot of sugar.
It is.
So yeah. All right. Good example. Good example. Good
I
example.
love cookies, but when I look at it like this, I'm like, I don't want that cookie. I worked too hard.
So one of the things that I know that that you like to talk about is physical activity and how physical activity can help decrease your blood sugar levels. You want to talk more about that, Bree?
Yeah, so of course, when we talk about physical activity, like we said earlier, you want to work out most days of the week. Do at least we tell our patients, and I think we're in agreement, 60 minutes, 5 days a week. So like a brisk walk, something to get your heart rate up. And I know that we talk about this in every single video, but it's true. So, but it helps. So basically what physical activity does for your blood sugar, it lowers your blood glucose levels. It also helps lower your blood pressure. It improves the blood flow. When you're burning extra calories, it helps to keep your weight down. It helps improve your mood. And in older people, it can eat, well, younger people, because
yes,
I did fall down the stairs recently, but it can help prevent falls and improve memory. And usually it'll help you sleep better because you've exercised and your endorphins are high and you're just probably released a lot of stress. So it helps you to sleep better.
Usually when I exercise, I try to exercise at least 4 days a week. So when I do exercise, I do go to sleep earlier. I don't have energy for anything else. Come home, take a shower, and go to bed.
Yeah.
And I try to exercise for at least 60 minutes.
Yeah. And that's after working all day, then exercising. So
yes.
Yeah, if you're a sedentary and you're you don't work, you're at home most of the day, I would encourage you to work out more than 60 minutes, because the other however many hours you're awake, you're just sitting maybe on the couch and then you're snacking and you're watching TV and you're just not doing anything. So the more
you're preaching to me the quarantine, when you're at home quarantine and you're really okay. All right, so the 60 minutes not gonna get it when I'm at home quarantine.
No, not. But like on the days that you work and you're out in the field, then that's fine. 60 minutes is sufficient. Do something. But like I said, if you're just sitting at home all the time, then just do 60 minutes in the morning, 60 minutes in the afternoon.
So a lot of my patients always ask me, well, Ms. Brenda, what type of exercise should I do? So the first thing I ask them, what exercises are they doing? Everybody tell me I'm walking, I'm walking up and down my stairs at my house. Or my office is, I park really far from the office so I can walk. So do you really consider that as physical activity, exercising? It is physical activity, but do you really consider that as exercising?
I wouldn't really consider it as exercise because, you're walking, but you're not walking consistently. You're walking to a destination and you're stopping and doing whatever you have to do. So when you stop, then your heart rate comes down. And the goal is to keep your heart rate elevated for at least 60 minutes.
Okay, so something like aerobic exercising.
Yeah, like cycling, running, jogging, brisk walk. If they have the water aerobics now, they have, if you have a hard time with like running or something like that. And for the older people, they have those little stationary, what are those things called? Where they, the bikes where they can just sit on the couch and do the bike.
Okay, yeah. They could pedal. It's
Yeah,
like a little bike pedal that they can just sit down and they can just pedal.
it's
I have a lot of patients that have those.
it's very mobile, and so some people will use it to do, do exercise their arms as well. So yeah, that's an option.
So one of the things that I do worry about with my patients who do exercise, who do diet, especially if they're taking like insulin or they're taking like glipizide, glimepiride,
Mm-hmm.
one of those medications that can really lower the blood glucose. So I tell them, if they're taking those medications, I try to tell them what exercises to do. And I want them to tell me what are they doing because I want them to check their blood sugars more often to prevent their blood glucose from dropping really low. The exercise can allow your blood sugar to drop really low.
That's very true.
Yeah, so I try to make sure I educate those patients, especially my elderly patients who still exercise, just to be careful because we don't want them to go into what we call hypoglycemia, where the blood glucose drops a little.
Yeah. And also is if you're on those medicines and you exercise, it's good to keep a snack with you or those glucose tablets just in case, while you're exercising, your blood sugar drops low. And you may want to eat like a very small snack, nothing too heavy because your body won't have time to, convert the food into energy by the time you start working out. So just like a small snack before you start exercising to keep your sugar from dropping too low.
Now, I had a couple of patients recently who had surgery, weight loss surgery.
Mm-hmm.
And with the weight loss surgery, they were able to get off their diabetic medications. So basically, it really helped cure the hyperglycemia that they was experiencing.
Yeah. And I've had, that after that weight loss surgery, I've had a couple patients who've been able to come off their diabetes medicine as well as their blood pressure medicine.
Okay. Yeah. So that's another option that some patients may have. So you have medication, you have diet, you have physical activity. Some people do the weight loss surgery. So it's different things that you can do to lower your blood glucose levels.
Mm-hmm.
Okay. Well, so what are some of the maintenance, Brandy, like when we with our diabetic patients that we talk about?
So one of the main things is to check your feet on a routine basis because if you get to the point where your diabetes is not very well controlled, you start to get like the numbness and tingling in your feet, and sometimes like you develop sores and you don't know it. So you got to check your feet. You should check it, once a day, every other day, multiple times a week. Some people aren't able to see the bottom of their feet, so we usually recommend using a mirror to look at the bottom, like the soles of your feet, or you just can have somebody else take a look at them for you.
A lot of my patients I send to the podiatrist because we have an in-house podiatrist.
Mm-hmm.
So I do send my patients to the podiatrist once a year so they can get a thorough foot check.
Yeah.
So that's another option also. Diabetic eye exams.
Mm-hmm.
So some insurances pay for a yearly, some insurances recommend every other year.
Mm-hmm.
So, but I do send my patients to the ophthalmologist for their diabetic eye exams, for their yearly exams, so they can check their blood vessels in the eyes.
Yeah, because if you develop diabetic retinopathy, which is damage from in your eyes from the diabetes, it can cause blindness and or just like blurred vision. So you'll gradually notice your vision starting to change.
And a lot of times I recommend a dental check, especially to my patients who have really, really bad teeth. So I recommend they see the dentist once a year. They get an oral hygiene check on their teeth. And if any teeth need to be pulled, hopefully they can get those teeth removed.
The part of the reason why that's important is because if you were to you have diabetes and you get an infection, it's really hard to get rid of the infection.
Yes.
I can't remember if we talked about infections and stuff in part 1. Do you remember, B?
Yeah, we did. We did talk about infections, and that will slow to heal if you have an infection, especially wounds.
Yeah.
Diabetes will cause it to be slower to heal because of the sugar. Yes, elevated sugar. Yep. And so another thing is vaccines. You know, they do recommend some vaccines to help.
Two of the vaccines that we recommend to almost all of our diabetics is the flu vaccine and trying to convince people to get the flu vaccine is sometimes very difficult. And I'm not like a huge advocate for vaccines, but when you have comorbidities and you're at an increased risk for developing diseases, or I know that it'll be complicated for you to recover from a disease, then I recommend it. So all my diabetics, I recommend you get the flu vaccine and the pneumonia vaccine.
Yes. And it's not that those vaccines are going to prevent you from getting diabetes or make your diabetes better, but you get infections. You can get infection, super infection from the flu.
Mm-hmm.
Pneumonia can be, bacterial pneumonia can be an infection. So therefore, having the vaccines that help you, your process with healing. I mean, if you was to get pneumonia or you was to get the flu, hopefully you won't get the strains that are deadly.
Right.
So the vaccine is to help prevent those deadly strains of pneumonia and influenza. So basically that's why maintenance. Okay.
So maintenance is a huge part of managing your diabetes. And then
go ahead. I'm listening.
I was going to say another part is making sure you go to your routine appointments, like with your primary care provider, because you, like we talked about before, you want to get your A1C checked every 3 months at least, so that we can make sure that your diabetes is controlled, and then get the other labs checked so we can make sure you're not developing like problems with your kidneys, your fingers and toes, making sure they're not numb and tingly, and making sure, like we talked about multiple times, is the diabetic retinopathy. So making sure the diabetes hasn't affected your eyes. So going to making sure you stay current with seeing your primary care provider is also important.
So diabetes is a really, really big topic. Like it's a very, very big topic. So we're going to take this month just to try to break it down every week, different aspects of diabetes and how to treat it, complications.
Yeah, and then if there's something that you have questions about and we haven't gone over it, then you can just send us a message on Facebook, Instagram, YouTube. You can email us. You can text us if you have our number. We are here for you guys.
I can't wait till we get back in the clinic.
I know.
I don't know. I like this.
Gotta move with the flow, B.
Yes.
This is how most people are communicating every day. So, but I do miss our clinic time together, even though we're only there 1 day a week together.
But still.
Yeah, COVID has affected us and us all in like so many different ways. Yeah. So.
Okay. Well, that was a pretty good talk about diabetes.
Yeah.
And some of the things that we can do. So, tomorrow I'm going to walk up and down my stairs a couple of times. We're going to walk around the block. I'm going to do some things to get out for more than 60 minutes.
You can come and walk my dog if you want. Or walk my kids. You want to walk?
Yeah, I'm going to get up and get moving. Because for the last couple of days, I've just been inside. So I'm going to get up and get moving.
Yeah. And that happens sometimes, but you always got to just get it back going for the sake of your health.
Okay, so we do have some giveaways. Do you want to talk about that?
Oh yeah, so we will be giving away some glucometers this month for those.
I have some here.
So that we can help help you to better control your blood sugars. A lot of people don't have glucometers. These particular ones we got from Walmart, and we tried to get the ones where we can give them away to you, and then it's affordable for you to go and buy like the replacement supplies, like the strips and the lancets. Of course, you can get alcohol pads, or you can just get like a big bottle of alcohol, and then just use like paper towels or something, whatever, toilet paper, whatever you have at your house. But yeah, so
in order for them to get the giveaways, the glucometers, we ask that they follow us on Instagram and Facebook. And subscribe, please subscribe to our YouTube channel, BNB, the Community MPs.
And if you hit the little bell on the YouTube channel, then you will get notifications when we upload a new video, which we are trying to upload a video every week, at least every Wednesday. Wellness Wednesdays, we bring new facts, new information for you guys. So yeah, just support us, tell your friends, tell your family, because our goal is just to have a happier, healthier community.
Because why, B?
Because community
is our beauty. Yes.
So yeah, if you have questions, concerns, just, contact us. We'll get back with you. And until next time, bye.